You've never felt real pain. Not the kind that doesn't stop when you close your eyes. Imagine a broken bone with no hospital, an infection with no antibiotics, childbirth with no epidural. For 200,000 years, humans lived with agony as their constant companion. And yet they survived. They built civilizations. They raised families. How? The first painkillers weren't manufactured in labs. They grew wild in forests and fields. Willow bark contains salicin, the chemical ancestor of modern aspirin. Ancient cultures discovered this independently. They'd strip the bark, boil it for hours, and drink the bitter tea that resulted. It tasted terrible, but it worked. The throbbing would fade within an hour. The Sumerians called the opium poppy the joy plant. They knew exactly what it did. By 3400 BCE, Mesopotamian clay tablets documented opium cultivation and medical use. Healers would mix opium latex with wine or honey to mask the bitterness and control the dose. For the first time in their lives, people with chronic pain could sleep through the night. But plant medicine was just the beginning. Ancient humans were far more creative than that. Egyptian medical papyri describe over 700 remedies, many specifically targeting pain. They used pressure points, strategic touch applied to specific body locations to interrupt pain signals. Chinese acupuncture texts from 2,000 years ago map these points with startling precision. Thin bronze needles inserted just beneath the skin. Modern studies confirm it genuinely reduces certain pain types. But what about injuries too severe for plants and needles? Broken bones? Open wounds? For the worst cases, healers turned to something stronger. Mixtures that would alter consciousness itself. Psilocybin mushrooms, datura flowers, ayahuasca vine, hallucinogens used as emergency anesthesia. The healer would prepare the dose carefully. Too much could kill. Too little would leave the patient screaming. The patient would enter a trance state, their mind separated from the body's distress signals. While they were under, healers could set broken bones, cauterize wounds, even perform crude surgeries. Archaeological evidence shows skull trepanation, drilling holes into the skull, with clear signs of healing afterward. People survived these procedures. Their bones grew back. The skull holes closed over. There was another tool ancient humans had, one we've almost entirely lost: social pain management. The power of community attention, ritual, and collective care. When someone was injured, the entire group would attend them, touch them, speak to them constantly. Modern neuroscience confirms this works. Social support literally changes how the brain processes pain signals. Healing rituals served a dual purpose. The herbs and the ceremony both contributed to recovery. The patient's belief in the healer's power triggered the body's own analgesic systems. We call it the placebo effect now. Ancient healers called it magic. Both descriptions are accurate. Cold water therapy for inflammation. Hot springs for joint pain. Temperature as medicine. Heat dilates blood vessels, increases circulation, and distracts nerve endings from transmitting pain. Movement itself was medicine. Gentle stretching to prevent joints from seizing, muscles from atrophying. Ancient Chinese and Indian traditions developed elaborate systems of therapeutic movement still practiced today. Massage to release muscle tension. Firm pressure applied rhythmically, often with plant oils for lubrication. Healers would blend multiple plants together. Synergistic effects they understood through generations of observation. Willow bark for inflammation, valerian root for muscle relaxation, poppy for severe pain, all in one preparation. Topical applications for surface pain. Honey mixed with herbs created antiseptic wound dressings. Honey's natural hydrogen peroxide content kills bacteria. Ancient Egyptians documented this 4,000 years ago. Spider webs for bandages. The silk strands are naturally antiseptic and promote blood clotting. Modern medicine has confirmed spider silk contains compounds that actively kill harmful bacteria. But some pain couldn't be treated with plants or ritual. Chronic conditions with no cure. Arthritis. Degenerative joint disease. The slow grinding pain that only worsened with time. For these patients, the treatment was acceptance and the community's commitment to care for them anyway. Those who couldn't hunt or gather were given other roles. Storytellers, teachers, craftspeople. Purpose itself became pain management. Staying useful to the group gave life meaning beyond suffering. Sleep positioning strategies. Lying on the uninjured side, elevating swollen limbs with folded furs. Gravity helps drain fluid from injured tissue. They understood this principle through trial and observation. Some analgesics worked faster when chewed directly. The tissues in the mouth absorbed compounds quickly. Aromatherapy wasn't just pleasant. Lavender and chamomile vapors have measurable calming effects on the nervous system. Smoke inhalation for respiratory pain. Eucalyptus and mint cleared airways and reduced coughing spasms. Controlled breathing techniques. Slow, deliberate respiration triggers the parasympathetic nervous system. This shifts the body from fight or flight mode to rest and digest, literally changing pain perception. Meditation practices emerge independently in cultures worldwide. Focused attention as anesthesia. By directing awareness away from physical sensation, practitioners could endure remarkable levels of discomfort. For acute trauma, the bite stick, something to clench during procedures, preventing tongue injury. The pressure of another person's hand. Simple human touch that told the patient they weren't alone. Oxytocin, the bonding hormone, has natural pain-reducing properties. Human contact triggers its release. Children with ear infections or teething pain were held constantly. The warmth and movement provided relief. Mud poultices for insect stings and burns. The clay draws heat and toxins from inflamed tissue. Modern dermatology still uses kaolin clay for exactly this purpose. The ancients were correct. Sand baths in warm climates. The weight and heat provided relief for joint pain and muscle stiffness. Ancient healers understood something modern medicine is only now rediscovering. Pain is never just physical. It's woven through emotional state, social connection, belief systems, and environmental factors. Healers would listen to patient stories. The narrative of injury mattered as much as the injury itself. Telling the story of pain helped patients process trauma and gave healers diagnostic information. Group ceremonies for chronic pain patients. Collective rituals that reinforced belonging and reduced isolation. When pain couldn't be eliminated, it could be recontextualized, given meaning within a spiritual framework. Connection to nature itself served therapeutic purpose. Vast landscapes that put individual suffering in perspective. Running water for distraction. The constant sound and visual movement drew attention away from internal signals. Sound therapy predates written history. Rhythmic drumming, chanting, and natural sounds all alter consciousness. Repetitive rhythms synchronize brainwaves, inducing trance states that reduce pain perception. Modern neuroscience confirms specific frequencies in trained neural oscillations, literally changing brain activity patterns. Sun exposure for pain relief. Ultraviolet light triggers vitamin D production, essential for bone health. Vitamin D deficiency causes widespread musculoskeletal pain. Sunlight was preventative medicine. Distraction through meaningful work. Keeping hands and mind occupied reduced focus on discomfort. Cognitive engagement activates brain regions that compete with pain processing for neural resources. Tasks requiring precision and attention were particularly effective. The mind simply couldn't focus on two things simultaneously. Caregiving itself provided pain relief. Helping others activates reward pathways that suppress discomfort. Purpose through teaching. Passing knowledge to the next generation gave pain a context beyond itself. Perspective shifts through cosmic contemplation. Individual pain feels smaller beneath infinite stars. Acceptance didn't mean surrender. It meant acknowledging pain without letting it define existence. The oldest members of the tribe carried pain daily, but they also carried wisdom irreplaceable, creating beauty despite suffering. Art and craft as declarations that life continued beyond pain. Modern medicine focuses on eliminating pain. Ancient medicine focused on living meaningfully despite it. Both approaches have value, but we've lost something in our pursuit of perfect comfort. Preparation rituals themselves provided comfort. The act of making medicine was part of the medicine. Choosing the right plant at the right time. Harvesting with intention and gratitude. Many traditions spoke to plants before harvesting. Recognition of exchange, not just extraction. This relationship with medicine is foreign to us now. Pills arrive anonymous in plastic bottles. Ancient medicine delivery included presence. The healer stayed while the patient drank, monitoring effects. Follow-up care meant continued human connection, checking not just symptoms but emotional state and social reintegration. We've gained precision and power, but we've lost the understanding that healing is relational. Recovery was a community project. Everyone contributed something, even if just presence and encouragement. Those who healed often became healers. Pain created empathy that translated into skill. Suffering wasn't wasted. It was transformed into knowledge that protected future generations. Oral tradition preserved medical knowledge. Stories and songs carried dosage, preparation, and warnings. Medical information was embedded in mythology, making it memorable across generations without writing. Songs with specific rhythms aided memory. Each verse a medical instruction preserved in melody. The body's healing capacity inspired awe. Wounds closing, bones knitting, life continuing despite damage. Ancient healers understood they weren't creating healing. They were supporting the body's inherent repair systems. Energy healing practices, laying on of hands. Whatever the mechanism, patient outcomes showed measurable improvement. Modern research struggles to explain these effects. But the historical record is clear they worked. Morning rituals for chronic pain patients. Greeting the day with intention before movement aggravated symptoms. Slow, mindful movement before the day's demands. Preparing both body and mind for what lay ahead. This wasn't optimism. It was pragmatism. Pain would come regardless. Preparation helped manage it. Morning doses of willow bark tea. Taking medicine before pain peaked meant lower doses worked effectively. Preventive medicine versus reactive medicine. Ancient healers understood timing affected efficacy dramatically. Evening routines for pain management. Positioning the body carefully before sleep to minimize nighttime waking. Stronger doses at night. Sleep itself was therapeutic, so ensuring uninterrupted rest took priority. Sleep deprivation intensifies pain perception. Ancient healers prioritized rest above almost everything else. Someone always kept watch. Patients never slept alone. Fear and anxiety were managed through constant presence. Feeling safe allows the nervous system to shift from survival mode to repair mode. Gentle waking protocols. Sudden movement could trigger pain spasms, so mornings began slowly and deliberately. Assisted rising. Gradual transition from horizontal to vertical, giving blood pressure time to adjust. Mobility aids weren't stigmatized. They were pragmatic tools that kept people active and contributing. Using a walking stick didn't mean withdrawal from life. It meant adaptation that preserved independence. Patients often made their own mobility aids. The process itself was therapeutic, regaining agency, creating something beautiful from necessity. The stick carved with patterns, personalized, cared for. Comfort modifications, padding the grip, adjusting the height, balancing the weight for specific needs. Disability wasn't isolating because everyone had limitations. Community was built around mutual interdependence. The young were strong but inexperienced. The old were weak but knowledgeable. Both were essential. Pain and aging created teachers. Their lived experience became the community's medical encyclopedia. Chronic pain was visible and normalized. There was no pretending to be fine when everyone knew your reality. Pain was discussed openly. Daily check-ins weren't polite formality, but genuine medical monitoring. Adaptive strategies were shared freely. If someone found a way to work despite pain, everyone learned it. Innovation born from necessity became standard practice. Pain drove medical advancement through collective experimentation. Every generation tested new plants, new combinations, new techniques. Knowledge accumulated through careful observation. Before writing, cave markings and notched bones recorded medicinal knowledge. Physical archives of pain management. Failed experiments were remembered too. Stories of what not to do prevented future harm. Warnings preserved through story. Dramatic narratives of overdose and toxicity, memorable and specific. Medical knowledge was survival knowledge. Communities that preserved it thrived. Those that didn't perished. The first moment pain subsides after days of agony. Ancient humans knew that relief intimately. That feeling of liberation. Moving without wincing. Thinking about something other than hurt. We take pain-free existence for granted. They celebrated each day the body cooperated. Eating without nausea. Sleeping through the night. Walking to the river. Small miracles, deeply appreciated. Gratitude for the body's function. Not perfection, just basic cooperation with survival needs. Their relationship with pain taught acceptance without resignation. Endurance without despair. They understood suffering could coexist with dignity. Pain didn't diminish personhood. Modern culture often treats pain as failure. Ancient cultures treated it as part of living. They built temples with arthritic hands. They hunted with old injuries. They continued, raised children while managing chronic pain, taught skills while joints ached, loved while hurting, not because they were stronger than us, but because they had no choice and a community that understood. We've solved many problems they faced, but we've created new ones. Isolation, disconnection, modern pain is often managed alone. Pills and privacy, suffering behind closed doors. Perhaps the most powerful ancient painkiller wasn't a plant. It was presence, the simple knowledge that someone cared enough to stay, to witness, to help carry the weight. Ancient humans survived pain through chemistry, yes, but more importantly, through community, through meaning, through each other.